Hello, my name is Victor Vega Zambrano. I'm a medical doctor and a researcher from Peru. My master thesis aimed to develop an approach for the identification and selection of spatial scales for disease control and research, using tuberculosis in urban settings as an example. The findings of this thesis suggest that spatial scales are under-discussed in public health and biomedical research. In addition, justifications for the selection of spatial scales in urban tuberculosis research are not often provided. I concluded that selection of spatial scales is multifactorial, and it depends on the process we are addressing, the context, and the purpose of research. The motivation for this thesis was to contribute to our current understanding of health inequities. Indeed, failures on perception and knowledge related to spatial scales contribute to perpetuation of health inequities and missed opportunities for improving the policy-making process and design of interventions. I want to thank the province of Antwerp for giving me this opportunity to share the results of my research.
Hello everyone, my name is Millicent Makandi from Kenya. I'm a nurse by training and I just completed a master's in public health here at ITM. I'm excited today to share the findings from my thesis on experiences of burnout among nurses and midwives in Kenya during the COVID-19 pandemic. The study shows that across all 47 counties of Kenya, 79% of the nurses and midwives experienced burnout during the pandemic. Factors contributing to burnout included things like delayed salary payment, unmanageable workloads, lack of managerial support, and limited access to psychological care. And however, more years of experience, recognition, and professional development opportunities helped prevent burnout. And there were a lot of detrimental effects of burnout seen and influencing negatively the quality of patient care. There were also a lot of inadequacies within the health system to address these issues, and this calls for urgent need to improve the overall well-being of healthcare workers as well as their working conditions to help build a more resilient workforce, better prepared to handle even future public health emergencies. I chose this topic because practicing as a nurse, I've seen the first-hand challenges and demands faced by nurses and midwives, and also being introduced during the master's coursework into the intricate dynamics and the systemic issues within the healthcare system. I sought to solve these challenges, and particularly among the frontline healthcare workers who form the backbone of our health systems. I hope the findings from this study will help create a positive change, not just in Kenya, but around the world in health systems. Thank you.
Hi everyone, my name is Fien Goudenes and I'm originally from Belgium. However, I'm currently working in England as a full-time farm veterinarian. I've always had a large interest in epidemiology and tropical diseases, which is why in 2022 I decided to start my Masters in Global One Health at the Institute of Tropical Medicine in Antwerp. My research topic is the development of a biosecurity assessment questionnaire on pig farms in a resource-poor area and is based in the Sinda and Katete district in eastern Zambia. A prototype questionnaire was developed and tested out by 47 local pig farmers and continuously adjusted whilst doing so. The final prototype questionnaire contains 75 questions that were thoroughly tested for clarity, usability, and relevance. This questionnaire will hopefully be used in the future to assess biosecurity levels on farms and will be able to deliver farm-specific advice. I decided to write my thesis on biosecurity as I think it is a topic that is still lacking research and local knowledge regarding biosecurity is often minimal. Biosecurity measures can play an important role in the control of common pig diseases such as African swine fever or zoonotic diseases such as Taenia solium. I'm hoping that once the questionnaire is in full use, it can increase awareness and improve knowledge surrounding biosecurity, which will hopefully aid in a reduction of disease transmission. I would like to thank my supervisors for guiding me through this research, and a special thanks to the province of Antwerp for this award.
My name is Pedro, I'm from Brazil. I'm a biologist by background, and recently I graduated in the Master of Tropical Medicine here at ITM, and I'm currently working at the Clinical Virology Unit from the Clinical Science Department. So my master's thesis involved the development of a protocol for genomic sequencing of monkeypox virus clade 1. With this protocol, we hope to help in the characterization of mpox outbreaks that are ongoing in DRC together with the National Institute of Biomedical Research in INRB in DRC. Since the university, I was passionate about the field of molecular biology, genomic sequencing, and also during my first master, coming from Brazil, I developed this interest for infectious disease, and coming here to ITM and having this opportunity to apply my previous knowledge to infectious disease such as mpox, that it's public health issue in Central Africa, I would say that this is my main motivation for this topic and for this project. I would like to express my heartfelt thank you to the nomination committee, to ITM for all the support in this research, and also for the province of Antwerp for this award.
My name is Edison Butar-Butar from Indonesia. I'm taking Master Development Evaluation and Management. My research is a comparative case study on how the recent United Nations Sustainable Development Cooperation Frameworks, or UNSDCF, addresses sexual orientation, gender identity, expressions, and sex characteristic, or SOGSC issue in Indonesia, the Philippines, and Thailand. It explores the similarities and differences on their approaches and also the factor influencing them. This study reveals inconsistency on how this country addressed the SOGSC equality. Although 3 countries acknowledge the people who marginalized based on SOGSC part of the most left behind, however, this issue disappears in the operational level on theory of change. And this inconsistency are influenced by the lack of explicit guidelines, power dynamic within UNs, and power imbalance between the UNs and state member governments, and also prevailing social, cultural, and political context. This study called the UN to strengthen its commitment to SOGSC equality by introducing SOGSC marker, developing robust and inclusive M&E systems, and collaboration with people who marginalized the SOGSC group. This effort will contribute to achieve the development goals beyond the traditional and binary gender and heteronormative perspective, truly embodying the left no one behind principle. Thank you.
My name is Minh Anh Nguyen. I'm from Vietnam. My master program is Governance and Development. With using both primary and secondary data, my thesis aims to examine the affirmative action policies implemented in Vietnam to address the horizontal education inequalities, which are the disparities in education between ethnic groups, and to investigate the perceptions of ethnic minorities on these targeted programs. The key findings indicate that there are significant gaps in educational opportunities, with the minorities facing more disadvantages compared to the majorities. Furthermore, despite ethnic minorities' positive attitudes toward these policies, certain issues still exist. The policy recommendations include setting higher eligibility criteria for affirmative action beneficiaries and broadening the reach of support to include disadvantaged people in non-targeted areas. Thank you.
Hello, I'm John Paul Corpus from the Philippines, and I attended the Advanced Master of Globalization program. Financial globalization has increased flows of capital into developing countries. My thesis seeks to estimate the effects of external capital inflows on structural change in developing countries. Structural change is the process of economic transformation where an economy shifts away from low productivity towards high productivity activities. My research focuses on the size of the manufacturing sector in Southeast Asia's 4 largest developing economies, namely Indonesia, Malaysia, the Philippines, and Thailand, which are collectively called the ASEAN 4. Using a variety of econometric techniques, I find evidence that net aggregate capital inflows have a negative effect on the employment share of manufacturing. The negative effects emanate particularly from inflows of non-foreign direct investment capital, particularly portfolio investment and portfolio debt. Meanwhile, inflows of foreign direct investment have a positive effect on the output share of manufacturing. So my findings imply that different types of capital inflows have different effects on manufacturing output and employment. Therefore, policymakers must pay close attention to the different effects of different types of capital on their industrialization efforts.
Hi, my name is Uya Treure, a master's student from Antwerp University. For the International Relations and Diplomacy program, I wrote the thesis, The Balls in Your Court EU Towards an Externalization Policy that is Fair, Humane and Adequate. Maybe you'll remember Alan Kurdi, the drowned traveler at the Broden Beach who made the world shudder on September 2, 2015. Many will now have forgotten this tragedy as the issue of migration has appeared regularly in a wide variety of newspapers throughout Europe. In my thesis, I tell you more about the flow of migrants that have attempted to reach the EU's territory and the EU's approach to this. With my thesis, it became clear that the securitization of migration after the 2015 European migration crisis influenced the EU's externalization policy through the strengthened functioning practices of Frontex and the EU's intensified cooperation with third parties. In short, these findings imply that the EU's externalization policy provoked the occurrence of human rights violations in countries like Libya and Tunisia, and that the EU is still far away from an externalization policy that is fair, humane and adequate. Furthermore, I'm really delighted to be receiving the Global Research Prize. I hope that in the future more attention will be provided to this subject to make the EU's approach to migration more humane. Thank you.
Hello, my name is Safa and I recently graduated as a midwife at the Artes Patijn University College in Antwerp. In my final year, I worked as an intern at the labor ward of a rural regional referral hospital in Uganda. In Africa, postpartum hemorrhage accounts for 1/3 of pregnancy-related mortality. For my final project, I developed a tool aimed at improving the management of primary postpartum hemorrhage. My project focused on creating a scientifically based tool tailored specifically to the needs of the midwives at that hospital in Uganda. The tool provides clear guidelines and an efficiently step-by-step approach. Additionally, I worked on optimizing the emergency box to ensure that essential materials are available when needed. The implementation of this tool was crucial for timely and appropriate interventions, which will significantly reduce maternal mortality rates. I am honored to receive this award, and I want to extend my gratitude to the province of Antwerp, AP University College, the amazing healthcare workers at that hospital, and everyone involved in supporting my project. Thank you very much.
Hey, I am Mandy Molenbroek. I am 23 years old and I just graduated from St. Lucas Antwerp with a bachelor's degree in audiovisual techniques photography. For my graduation project, I created a documentary series called Cuéntame. Thank you very much for this opportunity.
Hello, my name is Peter Bester and I am a student in electromechanics at the Thomas More University of Applied Sciences in Belgium. Together with my fellow student Timo van Dam, we wrote a dissertation called Dimensioning and Building 2 Drinking Water Installations in Ghana. For this project, Timo and I traveled to the warm and dry northern region of Ghana where we built 2 drinking water installations for the villages of Guno and Kapano. These installations are fully autonomous and consist of solar panels, borehole pumps, water filters, water disinfectors, and water storage tanks. We also taught the engineering students at the local university how to maintain the installations. These installations provide safe, clean drinking water to around 1,000 people every single day. So far, our installations have produced over 3.1 million liters of safe drinking water. I would like to thank the province of Antwerp for this award and for allowing us to share our project. Lastly, I would like to thank the villagers of Guno and Kapano for their cooperation, their kindness, and their hospitality.